Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the rise in substance use in children during the pandemic. I'm here today with Molly Pellettiere, substance use counselor with St. Luke's Crittenton's Children's Center's Substance Use Intensive Outpatient Program. Thank you so much for joining us.
Thanks for having me.
Substance use and dependency has increased during the pandemic. With the impact on children's mental health and the feeling of isolation, experts say this is a perfect storm for substance use in children to rise. The sooner the issue and underlying causes are addressed, the better chance children have warding off bigger substance problems and effects in the future. So, Molly, during the pandemic, substance abuse has risen in adolescents and teens. Why do you think we're seeing this trend?
Isolation has long been known to be an important component where substance use is concerned. People use because they feel disconnected from others, feel like they don't fit in, they don't belong. It helps with social anxiety, and this is with adults and adolescents. And so they use to help fit in and feel more accepted. And the pandemic has just increased the isolation so much that we're seeing adolescents use to cope. They're not having their normal social outlets. More of that's being done by themselves and alone. We've seen an increase in alcohol use and marijuana use during this time.
So what's the relationship between mental health issues like depression and anxiety and substance use?
Well, they kind of go hand in hand. We call them co-occurring disorders, and you really need to treat them both at the same time. Like, you couldn't just treat the anxiety or the depression or the mood disorder with medication and expect the substance use to magically get better. Because once the brain has learned that using substances helps make those feelings go away, at least temporarily, you don't forget that. And so part of our treatment is helping them get better coping mechanisms, better tools that they can use so that they can function in a healthier means. And conversely, you can't just treat the substance use, get them clean and sober, and expect all of a sudden that their mental health issues are going to get better. You do have a clearer picture of what the mental health issues might be and the severity of them when you get a kid clean. But you still may need to follow through with trauma therapy, medication, more individual family therapy, things like that.
So how does substance use affect a teen's brain and development?
Well, we know that a person's brain doesn't really finish developing until they're about the age of 25. And the last part of their brain to develop is the part right behind the forehead, the frontal lobe. And that's the part of the brain where we have impulse control, judgment, decision-making, reasoning. And so when you start with a brain that doesn't have that fully function in place yet, and you add substances to it, which also attack that part of the brain first, you end up with a way more dangerous and risky situation.
So how does Crittenton's program help the adolescents and their families?
Well, it's an intensive outpatient program, and it meets 3 evenings a week. Monday and Tuesdays, it's just the adolescents that are in group, and then Wednesday, we have what's called a multifamily group, which is a really neat component of the program. It takes the adolescent and their families and puts them together with the other adolescents and families in the program. And we do a lot of education for the parents about how to cope with things that are going on, how to build trust, how to deal with lying and manipulation, and give them tools that help them differentiate between good parenting versus enabling.
So how do parents know that their teens aren't just going through a phase and that they need some help?
I think it's important for parents to understand that any substance use by an adolescent is misuse because of the developing brain component. And I have this saying, and I think it helps families understand. It doesn't matter what you use, and it doesn't matter how often you use or how much you use. It matters what happens when you use. And if things are happening in your life that wouldn't be happening if substances weren't a part of your life, then that's a problem. And then if you continue to use, despite the consequences, then you know you have an even bigger problem.
So what are some warning signs that parents should be looking out for?
I think parents need to trust their gut. If you're seeing changes in behavior in your adolescent, and maybe you're seeing a big change in their peer group, friends that you didn't know before, and maybe friends that your teen doesn't want you to know, and you're seeing maybe falling grades or dropping in activities that they used to be into, or a change in their mood or their interactions with you, maybe more sneaky behavior. And if the puzzle pieces don't fit, they don't fit. And there's a reason for that. And you need to trust your gut.
So if parents are concerned, what can they do to help their children?
Well, they could call Crittenton, and we would set them up with an intensive outpatient assessment. And that is a biopsychosocial substance use assessment, and it identifies the problems, the extent of the problems, and whether they need treatment at the intensive level or maybe just at an outpatient level, or maybe they just need a brief intervention.
Okay. Well, thank you so much for joining us today, Molly.
Thank you.
If you'd like to find out more about St. Luke's Substance Use Intensive Outpatient Program, visit stlukeskc.org/substance use. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.